Hello, my name is Jay Wheeler, and I'll be doing a presentation on the health careers, physical therapy, and physician assistant. Um, what is physical therapy and what do physical therapists do? Physical therapists are people who work with individuals who have been injured or possess health conditions that cause them physical pain and discomfort. Physical therapy can contain hands-on activities that consist of physical activities such as stretching and exercises that key the specific body part that the patient is rehabbing. Physical therapists help prevent the chance of re-injury through physical therapy as well as educating patients on what to do and what not to do with their body past their injury. Physical therapists possess the skills and knowledge of the body such as joints, muscles, etc. This is learned through anatomy and many different classes that people have to take in order to become a physical therapist. Physical therapists have great people skills and most importantly, they have the big passion to help. That's the biggest thing that people will look into for you to become a physical therapist, get into post-grad school, is your passion to help, your clinical hours, your volunteering work. People look for stuff like that because it is extremely important. The physical therapy salary and job openings. The average salary in the state of North Carolina for a physical therapist is $63,000. It varies from where you work from state to state. It can be higher in places such as Texas and California, where there's a bigger market and people that have more opportunities to work with different people make more money. So it increases based off the state, and it can increase over time through the profession. Like almost like a veteran thing. Like you increase rank, you also increase how much money you make. And the only openings I could find in the place that I live in Fayetteville are full time at Fayetteville Orthopedic. The work setting. Physical therapists normally work in a clinical setting. Right here, the picture at the bottom is a great example. The tables where the patients will be at, multiple exercises that they can use, multiple areas they can use to attend whatever body part is hurting. They can work in various settings such as hospitals, sports facilities, schools, colleges, to be specific, and nursing facilities. Physical therapists can also be self-employed. I know physical therapists that can travel. They travel to different patients and they practice their own personal practice as you need your license for this and many other different things to be able to conduct this practice without getting type of legal trouble. Physical therapy, the education that is needed to become one. In order to become one, you have to get your bachelor's degree in a science-related field, and then in this case, exercise science, because that is what I am in. You have to obtain your DPT and go through internships and hands-on training. And as you go on your hands-on training, you will be supervised heavily. You must complete the National Physical Therapy examination after you graduate, which is required for everybody if you want to become a physical therapist. Must also obtain your state licensure, and it's different from state to state policy, so it'll be different from in North Carolina than South Carolina if you are a registered licensed physical therapist to work in the clinic or wherever you may please to work in your preferred setting. Now on to the next topic. What is a physician's assistant? A physician assistant are people who examine patients and carry out almost the same responsibilities as a doctor. PAs can prescribe patients prescription medicine, can also look over their medical records as recent and keep updating them. They can stitch wounds and bones and even diagnose patients with health conditions, similar to what the doctor does. Almost like lays out the foundation for the doctor. Physical assistants can also specialize in different fields such as specifically surgery, psychiatric work, and also even dermatology. The salary for a physician assistant is around $93,000 or $93,390 in North Carolina, and it varies from state to state. Physician assistants median salary in the United States is right above $100,000 a year. Also, like physical therapy, it varies from state to state. There are a few job openings where I live in Fayetteville Orthopedic and Cape Valley Hospital in Fayetteville, North Carolina, to become a physician assistant. You can also say they are needed due to the times we're in with COVID. The work environment for a physician assistant. A physician assistant can work in a various of settings such as hospitals, colleges, clinics, and for the government, specifically government agencies. The work environment can affect a physician assistant in different ways in their specialized fields, as you can specialize psychiatric work, dermatology, as your setting and your time on your feet might be a little different based off what field you specialize in. But all environments are pretty much the same, just different work based off what you specialize in. Education required to become a physician assistant. In order to become a physician assistant, you must have a bachelor's degree. And you must, it's all required for most of them, to be a 2-year postgraduate program from a credit program so you can achieve your master's. You need many hours, over 100 hours of clinical training, a family and emergency medicine, so you can learn that. The physician assistant national certifying examination must be taken and must be passed in order to receive your license to become a physician assistant. And you need to be recertified almost every decade, and like every 2 years you take over like 100-hour courses so you can stay recertified and keep a certification as a physician assistant. My reflection on the physical therapist, this is personally what I want to be. Being a physical therapist, the biggest thing for me is passion. I get to help people, which is my biggest thing. I would help people obtain and regain a better quality of life. I get to more work on hands-on with people, have conversations with people, how they really feel physically and mentally. Most important, I wanted them, to feel better about themselves physically. And being a physical therapist comes with a lot of hours of hard work and interesting situation that comes with the passion for the profession. You should know what you sign up for. Only concerns I have to do situation is COVID. Be in close contact with people. That's probably the biggest concern. But other than that, I know what comes with the profession. I know what signs up for it, the schooling, the 2 years afterwards, the vigorous hours of learning, training, supervision, tests, and all that internships comes with the profession. Physician assistants. The more research I did into this profession, the more I figured out it is not for me. I do not mind the work environment nor the tasks, but I feel like the pay could be better just because the more reflection it does of a doctor. I think they should be paid more just for the simple fact the tasks that they take care of is very significant, and they are pivotal in the roles of treatments and the diagnosis of a patient, which is very critical, which was the reason why you were there. They are mandatory in the balance of the health force as they help do the tasks that is needed for a doctor to go further. Like I said earlier, the physician assistants lay down the foundation for the doctor. I did not. One thing I learned new about doing this presentation, I did not know that physician assistants have different fields and can specialize in those based on the skills they learn and what field that they master. They also work very vigorous hours, full-time jobs, and even work holidays, which is normally required. But as I said earlier, it's their passion, their job is what they want to do, so that's what they're going to do. And that concludes my presentation.